everybody. Welcome back to the Fire It Up with CJ show. We are continuing our conversation in part three about facial acupuncture. We have Jenna Beam here talking from the Health Discovery Acupuncture. And we are going to be talking about the logistics of facial acupuncture. Who is it good for? How much does it cost? What's involved when I go in for a treatment? So welcome back.
Hi, thank you. It's fun to be back.
Yeah, so who is really the best candidate for facial acupuncture? I mean, what age should you go in at age 30 as a preventative measure? If you're age 60, is it too late? Like, when's the best age and who should show up?
Never too late, first of all.
Okay.
But for sure, so it's always easier to prevent a wrinkle than to fix one that's already there.
Hmm.
So prevention is, I mean, that's just the tenet of Chinese medicine, right?
Right.
Prevention is better.
Right.
So with that, we would say by age 35 is a good time to start because that by then your skin is, so there's a saying I don't know if it's in Chinese medicine or in the facial community it's specifically, but before 25, you have the face your parents gave you.
Hmm.
From 25 to 40, you have the face, your everything, your experiences and your expressions are creating your face. And after 50, you have the face that reflects who you've been.
Oh.
So, so it makes sense that if the earlier we work, it actually helps you process your emotions and get more healthy into the future as well. But doing it around 35 to 40 is ideal.
Right.
To start. And if you do a full protocol, then you're going to support your body so you won't get as heavily wrinkled as you might have otherwise.
Right.
But there's no way we don't exactly have placebo-based control studies
Right.
to try that.
Right. So age 35 is ideal, but if I come in at 55, it's not going to be, or 65 or 75, I'm still going to see results. Will
Absolutely.
I see less results, or like, can I be 70 and get down to 35? Like, what is within the realistic outcome at that point?
Good question. And a lot of that there's no way to answer that in some blanket statement. A lot of it depends.
Right.
Like my mother, for example, has been getting facial acupuncture. I have Lillian treat her for boundary reasons. It's good to not
Right.
treat your.
Yeah, I'm putting a needle in your face, Mom. Now, do you
Right.
remember when I was in fifth grade, you couldn't do this?
First of all, we're not that aggressive no matter what.
Just kidding.
And it's good to have just, my mom's always my mom. So even when
Yeah.
she's on the table, she's
Yeah,
still mom.
absolutely. So what kind
But
of results has your mom seen?
wonderful. Like she looked like people have not believed that she's old enough to be my mom.
Wow. How old is your mom?
She's 64
Okay.
in a month.
Right.
And she looks great. She looks like she's in her early 50s.
Wow.
She looks healthy and vital, and she always wants more. So she's done, I think, 2 protocols over the past 5 years, which
Wow.
and she looks great. And she's had so many people ask her what she does, like, have you had work done, and this and that. Especially if there's been a gap, it's when they saw her last.
Right.
So she is a great success story. She also wanted to tighten up her neck, and those are some of our most dramatic results that we have in pictures.
Oh yeah, I have a girlfriend who's always like this thing. So I guess her neck kind of gets baggy and like there's like a little gobble gobble thing going on. Is that so?
Right.
So is that so? Her neck
It's
is
a
tight.
terrible name for it, isn't it? The turkey or whatever. Yeah.
Well, that's what she called it, not
No,
me.
that's
So
what
she's
they
like, I
call
hate
it.
this gobble gobble thing. So what this thing does? So you're saying it actually? What does it do when you do the neck thing?
Well, so we actually release the muscles down here all the way up to here. So it's
Ah.
like it lifts and tones at the same time as we can actually help spread apart and release the tension.
Ah, okay, got
Yeah.
it. So the areas are, it seems like in terms of what people are looking for is this area here, the smile lines here, the marionettes here, the sagging here, and then the neck. These are our vanity points or things that we hope to look better. Are those the primary ones, or is there anything else?
Yes, but the way we look at it is we want the whole face to improve, right?
Right.
So we don't get as fixated. I mean, to be fair, halfway through the treatment, we start to really dive into the areas that are most important to the patient.
Right.
But we just start off getting just the holistic, like, let's just.
Ah, okay. So you're not going to be like, okay. So like when you go in, when I've gone in, they've said, what parts don't you like? And I'll say, I don't like the 11s. And so they'll focus on this. And like, if the rest of it's like I have to prioritize which one to work on. And they're like,
Right.
we can only work on one thing
Right.
versus, because I go in there, I'm like, I don't like all the things that I don't like, sadly. But,
Oh, right. But that's our mindset as Americans.
right, yeah. Whereas you're going to work on my entire face. And if I said I really don't like this, you would actually do a couple, you would focus on that at one point. But overall, my whole face is going to
Right.
look better. I
That's
see.
not only look better, but you will be healthier, right?
Right,
Because we're working on the internal systems as well.
right.
So we want you to not just have healthier looking skin, but have truly healthier face and
Right, a
skin.
healthier body, mind, spirit, organs.
Exactly.
Okay, got it. So that's, at any age, ideally 35, and you're going to see results.
Right.
Are there certain people that it just doesn't work for whatever reason?
Yes, and I'm one of them, and it bums me out because I get
What?
to work with all these women all the time and help them, but I get migraines, and if I have them very well managed and in balance, but if
Wow.
I bring all that chi and blood up to my head, it just triggers. It's just I'm not. It's contraindicated for my constitution.
Oh, wow. So some
So,
people you'll go and it just won't work for whatever reason, right?
right, and if they have high blood pressure, glaucoma, or anything where there's a lot of pressure up to the head, we're not going to increase that, right?
Oh,
Pregnancy, it's not the time, right? Your chi and blood needs to be in your uterus, not your face.
right.
So like and if somebody has a major health issue, we want to address that first and get them healthy and then dive into the facial acupuncture.
Okay. So what's an example of a major health issue that'd have to be resolved before you do that?
Cancer,
Mm, okay.
right? Or if they have diabetes and it's not well managed,
Mm,
or if you broke your arm, let's focus on the most important thing first.
right.
But
What?
if you have like slight insomnia or if you have like some hormone imbalance, it definitely helps night sweats, hot flashes. A lot of patients come in, they start to think about facial stuff around menopause, and then we get to
Mm,
also treat a lot of the menopausal symptoms. So that would be something that really works synergistically with the facial.
okay, so I wouldn't have to treat. So in the case of the cancer, I need to treat the cancer first before I
Yes.
actually focus on some of the other things, which makes logical sense. But
Right.
you're saying there's some things like menopause or hormonal things that I'm like, I may go in and I can get both treated at the same
Right.
time.
And
Okay.
digestive things as well. And everyone has something. So for the average person that's more or less healthy, this is great because it's going to support whatever those little things are that are out of balance as well as get their face
Got it.
looking great.
And is there a certain point where it's like you're not going to get anything because regardless of what time you come in, it's like it's just you're done. It sounds
Well,
like the answer is no, but I just want to clarify because it seems
well,
logically there's not a case like that.
my grandmother, who's 91,
Right,
often jokes with me like, "Can you do anything for this?" And she's very deeply wrinkled
right,
and she's beautiful.
right.
And at this point in her life, doing this is not that important. And her overall chi levels are lower than somebody half her age. So it's not the most important thing, right?
Right.
And so if at 91 you have wrinkles, I mean, that's okay.
Yeah, God bless you're alive at 91. That's a beautiful thing.
Totally. But
Yeah, I see.
she always makes those jokes at me.
Okay. But there's like Lillian's mom who may be older, right? Is she still doing it at what age?
Well, I don't know that I'm allowed to say that part, but
Okay, got it.
I know we're always bound by all these HIPAA rules.
Hmm.
But she does do it regularly, and she always wants Lillian to do it as well when she's around because she lives
Right,
in Taiwan, so
right.
they don't
Ah,
get to see each other that often.
right.
But yeah, so if you do your maintenance, you can really support your skin in a pretty profound way.
All the way into, let's say that let's instead of using Lillian's mom, let's just use like let's say someone all the way into their 80s or 90s. Like unlike your grandma, had I been doing this age
Yeah,
35, I
see?
could
Oh
probably
no,
be doing it
that's a
all
good
over.
question.
Yeah.
So we have that's to be honest, the 70s and well maybe 70s, but 80s and 90s aren't our target demographic.
Okay.
I mean, they're just not that. It's just a different time in life,
Right.
right?
Okay. Got it. So
So
those are
our
the
target market would be like 35 to maybe 70,
right.
where it's like we still want to look and feel young and vital, right?
Right.
We always do, but it's a really there's a lot more chi available
Right.
and lifestyle stuff, and you can still have a pretty interesting workout regimen and get enough sleep and stay hydrated. Like all of these things are going to
Right.
have a profound effect on your face.
Right. Okay, so that's a little bit about who, and let's go into the logistics because you had said in part one of our video that you would come for 6 weeks, 2 times a week, which is a lot versus like
Right.
basically getting, two Botox thing. You're in for like 10 minutes and then you're gone.
Right.
So why so many times? And
Yeah. Question.
is and yeah, and you said that there's like you had talked about Lillian's mom who has come in. She's on 2 protocols.
My,
Does that, or your mom rather, does that mean she's come in for 6 weeks
right.
during that time for two
Right.
2 years? Okay, got it.
Well,
Okay,
no, she did it over 4 years.
over 4 years. Okay, so
And
so
she did
once you do a treatment, which
the whole
is for
protocol.
6 weeks, how long does the treatment last for?
Okay, so I'm going to back up and talk
Okay.
to answer some of those early questions, and we'll
Yes.
work
Thanks.
into that. So the reason that we want to do twice a week for 6 weeks, it isn't just because that's some arbitrary decision.
Right.
It's because your skin has a cycle, and the skin cycle is anywhere between 4 and 6 weeks,
Mm-hmm.
and so it's really important. It's like learning a language,
Right.
right? So if you've ever learned a foreign language, if you study once a month, you will never create the neural pathway links to like learn that language.
Mm-hmm.
Similarly, with facial acupuncture, we're not just trying to support this little area once in a while. I mean, we are trying to create lasting change. So
Mm.
we need to let go of the old patterns. And as you know, patterns they take repetitious effort in
Right.
a short sequence.
Right.
So if back to the language, like if you go to a country and you immerse yourself in the culture and in the country, your brain will actually change patterns and link and learn that language. So the
Mm.
same thing, we're trying to teach the face how to relax and tone and to support it. And that's why we want the twice a week for 6 weeks.
Twice a week for 6 weeks, and is it you come in every week for 6 weeks?
Yes,
Okay, got
every
it.
week.
Okay.
And the other part of that is you're also getting the full body acupuncture treatment, right? So yes, it is time consuming, but I'll tell you, people come in looking forward to that.
Yeah, right, because they're actually, as we were talking about before,
Self care.
yeah, it's self-care as well. So it's actually, there's two things happening. And then, so it's twice a week for 6 weeks, 6 consecutive weeks. And if I miss a session, like, oh, I can't do, or on vacation, is that a problem? Or so do I have to look at my calendar and say, I can commit to this for 6 weeks?
We ask people to commit
Okay, got it.
because we don't want them to waste their time and money. The difference is, let's say we went 3 weeks and then we had to take 2 weeks off.
Right,
You're not going to hold the benefit from that 3 weeks because we didn't give your body that consistent information for long enough
right,
for it to hold. And we don't want, we're here for results.
right.
And when you asked how long do they last, let's say the average person will look 5 to 15 years younger.
Mm-hmm.
And I literally have a patient who's in her 50s and she got hit on at the bar by a 30-year-old and she's
Nice.
so flattered. And her husband is 60. And so when
Right.
he came out from the bathroom, she was just so, like, they all joked and laughed about
Yeah.
it. And she was just so touched. And he was like, I didn't think you were a day over 35, and she's 50. So
Nice.
that was a great anecdotal, but real story that
Right.
happened.
Right.
So it matters to go through the full protocol, and then it's like we reset the clock. Now the clock keeps ticking. It's not permanent, right?
Right.
But it's similar again back to sit-ups. Like if you do a lot of sit-ups, you might have great abs. If you stop doing sit-ups, it's not like you will forever keep those beautiful abs,
Right.
right?
Right.
But at the same time, your body's better off than it was prior to doing your sit-ups.
Right. And so, how long? So, your mom has done 2 6 week treatments over the 4 years, and she still looks great. Is that right?
Right.
Like, do you just come back when you're like, I don't look so great? Can I start all over again? Or is it better? Let's say that is it better for someone to come in
Once a
every
month.
every year for wait once a month?
Well, so once a month for just maintenance.
Okay,
That's
got it.
ideal. Like that, if we could have our way and have everybody get the best results possible, they would do a full protocol and
Right.
then they'd come back once a month, just maintenance.
Okay, got it. And then so they come back once a month
And
for
then they might not need to do a full protocol again.
I
But
see.
what happens is life gets busy, people move, they do their thing. So if they do a full protocol, they might and I believe in intuition, right? Like we can tell when we need something, right?
Right.
And so, and especially once you've done the full protocol, you'll know when you feel like you need it again. And I
Right.
would say probably once you could strategize if you wanted to think about it, would be once every 5 to 10 years.
So like once, so if I had done one whole 6 week program and I go once a month to then like after 5 to 6 years, I probably want to do another protocol. Is that what you
If
meant?
you did the once a month, you might not need the full protocol again. But let's say you did the protocol and you stopped coming.
Right.
5 years goes by and you're like, I want to do it again.
Ah, okay, got it. Okay, so that would probably be like, okay, I can't commit to once a month, but if you could come in 5 years from that point, then I see. And your
Right.
mom, so okay, got it. I get it. And
That's
so,
kind of what my mom did. She did that 4 years apart. And
okay,
she didn't quite finish the protocol. She wanted to get her face ready for my brother's wedding. And
that's
she,
sweet.
so she did the full protocol the first time. And then the second time she maybe did half, I would say.
Okay, got it. And so let's say that you can't commit to 6 weeks and you're going on vacation for a week or a week and a half. Like, what's the duration? Because a lot of times it's hard for people to commit to 6 weeks twice a week. So what's the longest period that you can go from your last treatment to the next one?
We would really, if they knew they had a vacation coming up, we would encourage them to find a different 6 weeks for sure.
Okay, wow. Okay, got it. So you
I mean,
really have to come in each
yeah, I
time.
mean, again, if you're gonna, the cost of the protocol is $14.99, so it's
Okay,
about $1,500.
right,
If you're gonna spend that money
right,
and you're gonna invest this time, we want it to be to your best interest.
right.
And we want those results to last as long as you're willing to hold them.
Okay, got it. But let's
So
say that I can, like, ideally come in on a Monday and Wednesday, but I can't come in till like the next Friday, the next week. Is that too far to
Friday, yeah,
start?
that would be okay if that was 1 week and hopefully later in the sequence.
Ah, okay, got it. So like in the initial weeks, you just want to be on it for like twice a week each
Yeah.
time. Okay,
And
got
what we have found is this really isn't, it sounds like it's a big inconvenience, but you'd be surprised. People, it make it work. And they, again, when they come in, they're looking forward to it.
it. Right.
And I've actually had them be like, oh my gosh, I'm almost finished. I'm going to miss this, you know?
Well, then come in every month.
Right. Because they want to, it feels good. It's really self-care, right? Because
Right,
they get to take a nap on a warm bed in the
right.
middle of their day. They get this whole pampering facial treatment. We talk about a lot of stuff, whatever's coming up for them. They get the
Hmm.
body treatment. So it's not a difficult thing to do.
Right,
It's quite relaxing and nourishing. And then they leave and they immediately feel more beautiful and
right.
more. I love to watch the self-esteem rise.
Yeah.
And that happens. I've seen it every single time.
Yeah.
Where
So
there's
it almost works out to like, wait, so there's six, so there's 12 sessions and it's four, so it's $120 each session. But in some ways you're getting a lot of stuff, right? Like you're getting the thing that you're talking about, which is almost like a certain type of, you're kind of getting a PT, a
right.
psychotherapist, uh, doctor, like all in one thing. So in some
Plus
ways, if
beauty
you,
regimen, right?
yeah, I mean, that's the way I think about it. It's like,
Yeah.
because the cost, I think, may be like, a wow, that's a lot of money. But then at the same time, you're transforming things.
Right.
You know what's so interesting? I work as a life coach, and I literally see people when I work with them just on their minds. They start changing their behavior, and their face changes.
Right.
So there's lots of
We're
different
not
angles that
separate,
you
right?
can, yeah, but I can see how, your face is changing and will also change everything. It can go in many different directions. But
Totally.
yeah, I've seen that in coaching that like over 6 months, because coaching is not intended to make their face look different, more
Right.
relaxed. But
Oh,
I've
why
literally
not?
see them, yeah, well, why, I mean, if it ends up being the ancillary effect, but I literally see their face changing as a result of that.
And
Okay.
regular acupuncture treatments are $90 for comparison.
Right. Okay. So that's like a standard
And we
acupuncture.
bill insurance 110, or re-exams are 120. So it's not a lot higher than our regular treatments. And we use a lot more needles, and the needles are more expensive. So there's a lot of things that it's just like you've got to have the cost up a little bit.
Right.
And again, it's worth it.
Okay, cool. And how long does the treatment last?
Each treatment is 1 hour.
Each treatment is 1 hour. Okay, so I have to commit to 1 hour over that time. And I assume it doesn't matter what kind of day, or I can do it at any point, like I have my period. All those different types of things can still be
Totally.
operative.
We'll
Okay.
treat you differently if you're on your period versus not,
Okay. Okay.
because that's important. Your cycle matters.
And then it's one of those things where I'm like, hey, while you're in there, can you actually work on my lower back pain?
Yeah,
Like you can actually work on other things
absolutely.
okay, in
Yeah.
addition. So you
We
can
don't do
actually,
as much hands-on because there's simply not enough time.
oh, you mean like you can't get massages and things
Can't
like,
do because we
okay.
want the needles to be in for 45 minutes, and it
Okay.
takes a good 15 minutes just to put them in.
Okay.
But we can do body points to anatomically map to your low back or to your neck, or so
Right.
we can do a lot within that treatment. We don't, like, I do a lot of craniosacral work, or we do cupping, things like that we just
Yeah, you're
simply,
not going to be able to do in this type of
yeah,
treatment.
you would
Okay.
need like a 2 hour treatment and their body would be like, I am done. This is too much.
Right. Now, the thing that I hear oftentimes with needles is like, oh my gosh, I cannot think the thought of actually someone putting a needle in me, like, ah, and it really doesn't hurt at all. It's like someone, like, if you went like this to yourself, it feels, and especially when I've had, you've actually given me an acupuncture session, it's like nothing. I mean, it's like nothing, like someone, like a raindrop hit your face.
Right.
Um, does it hurt for some people, or is there some people who are more, am I just insensitive, or do
No,
other
you're
people?
not. So that's a good question because for sure everyone's different, and there are some people who are more sensitive than others,
Right,
just to every kind of sensation.
right,
What I equate it to is like plucking your eyebrows, right?
right,
Like the first time you plucked your eyebrows, it was like, oh my gosh, this hurts because it's a
right,
new sensation and your body's not used to it.
right,
And then after over time, it's like it's nothing,
right,
right? And with acupuncture, I would say about 1 in 20 needles create some sort of sensation where you're like, ow.
right.
But and that's on average because some people it might be more, some people it might be less. So, but by the end of the protocol, they barely even like they're falling asleep while we're putting the needles in.
Right. Yeah, and when I've actually had acupuncture, the type that's the owies usually relate to really stuck energy, or something is
Sure.
there, and it's like, wow, whatever is there, you really like. I'll get
Right.
and this is not for my face, but for my body. Someone will put a needle. I'm like, wow, and I literally feel like the energy. It's almost like someone injected something, even though they didn't. It's just the
Right.
needle was injected, and I
Connected.
feel like energy pulsing, and I'll feel like they'll put them in my hand or something, and I'll feel it in my back. I'm like,
Right.
wow, I can feel that in
Yep.
my back immediately. So you feel those kinds of sensations too, but they don't
They're
feel
not
owie.
right.
They,
Well, we try to differentiate the language, right? If anything is sharp, burning, or electrical, that's a nerve sensation, and that's not our goal. We don't want to hit a nerve, or a lot of nerves have little tiny branches, so you might communicate with a little branch of a nerve, and it's not, no long-term anything, but it's unpleasant.
right,
But anything that you're describing is more the dull, achy, throbby, like that, or moving sensation. All of that is part of a therapeutic benefit. So
right.
I don't even apologize for that. I'm just like, okay, well, you're fine. Unless it's too intense, and then we can back it out. But I make sure if it's sharp burning or electrical, that's the needle I want to back out. And it's really changeable.
Okay,
And really, the worst case scenario, sometimes we cause a bruise. They
right,
happen.
right.
Lillian bruised me the other day. You can see him here.
Yeah, yeah. So that stuff like that
Yeah,
happens. And then
not
why does that bruising happen? Is there some way to prevent it?
Not really, because there's capillaries with
Hmm.
holding blood vessels all, or extending from the blood vessels, and nobody's perfectly anatomical as the book would say,
Right.
right? And so and we have to find where the chi is, and so you can feel it
Hmm.
when you're on those points, and the needle you can fit 17 acupuncture needles into the head of a syringe that would draw blood.
What? Oh my gosh. Okay.
They're
Wow.
really tiny, right?
Right.
So if even when we find that some of the acupuncture points can be big, or ones around the knee can be as big as this, like the
Wow.
actual point. So where you put the needle, it might touch a capillary and then you bruise.
Right, and you have no idea. And the bruise lasts for a couple days and it's gone,
Right.
right? So
I
it's
mean,
not
it's
awful.
part of the body,
Yeah,
whatever.
just put a little makeup or band-aid on and you're done. Okay, and so how about if you've had Botox or other procedures? Can you do this work with the, other types of procedures already done on your face?
Good question. Well, with Botox, we definitely want it to have worked its way out of your system
Okay,
before we do it. We don't want to dislodge Botox. We don't want to move it. We want it to have cleared.
okay,
The fillers are a little more complicated. It depends. Some fillers actually work synergistically with treatments like
hmm,
facial acupuncture, and some we wouldn't touch.
right,
And with facelifts, if you've had surgery, if somebody has spent like $20,000 on a surgery, I'm not going to touch that piece of art,
right,
right?
right,
Because we don't want to change or derail or mess with that. Like that was a choice. It was something big that they chose, and we'll respect that and not work with it.
okay, got it. But you can't even, you won't touch your facial points because you do your hands and feet, or like just no go?
Well, at that point, the changes are so dramatic that, yeah, if they've had surgery, I wouldn't work with them
Yeah,
in facial acupuncture. For sure with the body,
right,
absolutely.
right.
But I wouldn't put any needles in their face.
Okay, so now I'm interested. I want to go forward. What's my first step?
Oh, yeah. Come on in for a free consultation.
Okay, cool. And so what happens during a consult?
So we block off a half an hour to hear about your health interests, your health goals, your health concerns, because we want to get a good picture, and then what parts of your face you're interested in, and what your long-term goals, and hopefully they're not just the face, right? And if somebody has one spot on their face that's driving them nuts, then that person, we might say, if that's the only thing you're interested in, if that's the only thing that's really getting you, then perhaps Botox is better, because that will pop that out with a guarantee. With ours, we're going to soften everything. We're going to tone. We're going to support. But some wrinkles are harder to get completely resolved than others.
Right.
So,
Right.
excuse me.
Right.
So we put that with where they're at.
Okay, cool. So thank you so much. This has
Thank
been
you.
hugely, I hope all of you are excited, age 35 or whatever, to go out and try this, because it seems, no toxins, takes the benefits of actually having a holistic approach and many things being addressed at one time. So I'm in my 50s. So when you hit your 50s, like, you start having all these physical issues too. So you're actually improving the overall system as well as your face. It seems to, like, a threefer in some ways. So
Oh,
thank you so
thank
much.
you. This
All
was
right,
fun.
thanks so much, and we'll be continuing in part 4 to talk more about acupuncture. But that wraps up our series with facial acupuncture. Thank you so much.
It means so much to me that you're listening to the show, and love your support in any way by giving me comments below, or to subscribe to the show, or share the show with friends. Thank you again for your support. Love and blessings.